Welcome back to LEMD's live educational series. This space we've built specifically for our community to come together and go deeper by asking real questions and walk away understanding what's actually happening in our body. I'm Lauren Nashir. I'm the Director of Medical and Pharmacy Operations at LEMD.
And I'm Sam Thompson. I am the manager of medical and pharmacy operations here.
And we have a lot to cover tonight. Things have been moving so fast over here, which is nothing new. For those of you who've been following along, you already know Launch Week at LEMD is a very exciting time, and we are so thrilled to bring a new product to you called KLOW. This is our most advanced peptide formulation yet. It's 4 peptides in one with BPC 157, TB 500, GHKCU, and KPV. This was designed to support your body's overall wellness, repair, and restoration processes. And if you've ever felt like your body isn't just bouncing back the way that it used to, this conversation tonight is for you.
And then to walk us through the science behind KLOW and what it means for your health, we welcome back Dr. Jason Pencek. Dr. Pencek is a board-certified nurse practitioner and chiropractor who blends traditional medicine with integrative and longevity-focused care. He started in nursing, expanded into chiropractic medicine, and has now spent over a decade working at the intersection of peptide therapy, hormone optimization, and metabolic health. He works closely with patients on GLP-1 therapies and sustainable weight management, and his whole approach is rooted in treating the full person, not just the symptoms. Dr. Pencek, we are so excited to have you here today. Before we dive into all of the science and benefits behind KLOW, and without giving away too much, what excites you most about this product?
Oh, I mean, it has all the good things we love for inflammation and helping reduce, um, you know, basically any injury that I have. I think I've talked actually just recently, I think I made a reel, no, a story. I talked about how I absolutely love BPC 157. It's my absolute favorite peptide in the world. And this combines my favorite peptide with all of my other favorite peptides for repair recovery. And right here's the thing: as we age, repair and recovery go down. And all we can do is help keep those systems going. And that is why the addition of KPV to the glow stack is such an amazing thing because, again, we'll discuss probably some inflammatory aging. As we age, inflammation goes up. And now we have something to add to this to keep the inflammation down while we repair and recover.
Amazing. Well, by starting to set the foundation, how does our body naturally repair itself? And what does that kind of mean on the cellular level?
Yeah. Um, when inflammation goes up, you start to see changes to tissue. You can see it in labs as well. One of the most common labs we run is called an HSCRP, which is a high sensitivity CRP. Lets you know if there's inflammation going on. You can look at sed rate, you can look at ferritin. There are different markers we can pull on regular labs that most of you should actually be getting done. When you start to see changes at the tissue level, what's going to start happening is you need mitochondria that are functioning, right? Anything that happens in our body to repair, recover, anything that goes on, you need well-functioning mitochondria because this is your power for your body, the little powerhouses. Now, it's oversimplification by saying mitochondria are the powerhouse of the body, but these are what are going to reduce or improve, sorry, your amount of energy coming out. So we have to have enough energy at a cell level. That's basic. So there are other peptides that LED offers, such as MOTS-c, which can help mitochondria. So they're not typically thought of as a repair peptide, but if you don't have well-functioning mitochondria, you can't repair. Secondarily, we need good stem cells. So as we get older, stem cell production goes down. You're not making as good quality stem cells. You have less available in bone marrow than you did when you were younger. So you need both. You need stem cell signaling. You need stem cells to work. And we also need what's called angiogenesis. So angiogenesis is the formation of the blood vessels. If you have a tissue injury somewhere or injury or anything going on, if you can't get blood flow to that area, it's useless for repair. So the whole point of repair recovery is going to require, energy. It's going to require stem cell activation. It's going to require bringing blood flow to that area, and then also lowering inflammation. If you have inflammation in that area, it doesn't matter what I do. If the inflammation stays up, we can't actually get that repair going. There's inflammatory cytokines in that area, and once those start to go away, you can actually repair and recover tissue that's been damaged.
It's amazing. And as we age, you mentioned, right, these processes get less efficient. Is it because we're producing less stem cells? Or are they just working less efficiently? and others.
Yeah, it's aging. Both of you ladies look like you're in your under 30, at my guess. Once you hit 26, guess what? Everything just does this. That's the end of growth. Now it's how do we hold our body there as long as we possibly can. So part of the aging process is we lose stem cells. We lose the ability to make them as well. So when you're young, you're making so many stem cells. Little, obviously, kid. This is why when people do stem cell treatments, they talk about using stem cells in practice. We're using stem cells from cord blood or from the placenta. Now, this has the most amount of stem cells as possible. And when you start to get older and older, those stem cells just start falling off, by like multiples of 10, 100,000. So you start to get older and older, you have less available. So everyone that I talk to when I use stem cells in practice, I use some of these injectables. There are some doctors out there that like to use what's called autologous, so use it for your own body. When you're really young, autologous stem cells is great. We pull them out of your bone marrow, we can make a lot. When you get older, you have a lot less of these. So it's the just pure aging process that reduces all these things, right? As we get older, we get what's called inflammatory aging. So inflammation goes up. As we get older, we're not making as many quality blood vessels. Our stem cells aren't as good. Our mitochondria don't work. So all these things just start to decrease as we age. And return to function is what we want to do, right? I mean, LEMD's focus has been how do we help people feel better? And I feel like after talking to Honey, it's been a movement towards how do we help people live longer and feel better? How do we move to health span, right? Where we want to return to function as best we can. And unfortunately, as we get older, all these things happen. Ladies, you guys are still very young. Aches and pains don't happen, but you start to get your 50-year-old, 60-year-old, 70-year-old women, even your men, right? As we get older, osteoarthritis kicks in, right? You start to lose hormones as you age. Inflammation goes up, and these things lead to worse healing. When inflammation's up and you don't have enough stem cells, now you have a recipe for disaster. You're not going to heal anything, right? That's why as you get older, low back pain kicks in, right? We have arthritis kicks in. These are going to be symptoms of poor function mitochondria, inflammation, and again, not enough blood flow to these areas.
Yeah, I love that you brought up health span because really that is one of our missions at LEMD is extending the health span. Western medicine has done a great job of improving our lifespan. But I used to work with elderly just like Honey, and you see many of these elderly patients in homes and they don't have quality years left. So they're living, but they don't have a quality life and they're not self-sufficient. It's really important. And on the note of right aging, and I know you said we're in our 20s, I'm curious about collagen levels. I've heard they decline around like age 25. Can you talk a little bit about that? And then kind of great segue into GHKCU and what it does for collagen.
Remember how I just said 26 and you go downhill? Um,
I'm
Pretty much
26.
how it works. You're 26 now? Okay, well, I wish you the best now. At this point, it's just this way. You better get on a KLOW immediately. Um, so here's the thing. It's really funny. The girl who cuts my hair, I've been doing this for 5 years. I remember she turned 26 and I said, congrats, you're now done growing. It's just gonna do this. It's probably the worst birthday message I can give someone. But here's the thing that comes in is we have options now, right? It's almost like I listen when people say health span and Ellie's or Honey said this out loud now. She said health span matters. And this has been the focus has been I think the shift that we're looking at Ellie is to how do we get this going? And when you're getting older, collagen production goes down, elastin production goes down, right? So what's this mean? More sagging skin, less tight skin, more lines and wrinkles. Not everyone can be what am I thinking of? Chris Kardashian, right? Or it's Chris, whatever, what's the last name? Whatever her last name.
Chris, yeah.
Whatever. The one who got the facial. She's got this giant, spent 100,000 on her newest face. Not everyone has access to that, right? So what can we do for people out there that are every day? They're like, hey, I don't want to age. I want to slow this process down. Yeah, facelifts are great. They do a really wonderful job as you get older. But what do I do day to day? This is the same thing I talk about when I talk about stem cells. When you start to see a decrease of function, we start to work on it. And this is where your GHKC really comes in, is a collagen producing peptide. It's going to improve how much collagen you make. So GHK by itself is basically the main peptide and adds copper to it. So copper is added in. Each dose of GHKC when you're doing 2 milligrams is about 300 micrograms of copper every day. So I know one of the contraindications is going to be Wilson's disease for people out there that have been, turned down because of this. I will tell you the amount of copper in there is about a third of what the RDA is. So it's a very small amount of copper actually in each one of those injections. But if you're taking a lot of copper in, if you're taking extra copper in, it may not be a good idea. I used to recommend zinc to everyone on GHKCU, and I stopped recommending it as much because realistically, the amount of copper we're putting into someone is such a small, small amount that doesn't really change the copper to zinc ratio. Again, as long as you're not having extra copper in any supplements you're in. So the big thing is as we get older, skin changes, right? Why do we have Botox? Why do we have filler? We have these things because our skin starts to sag, it starts to get more loose, we start to get lines and wrinkles, right? Our hair production kind of slows down. We have more inflammation at the hair level, so we see more balding, especially in men for sure. It happens to women as they get older too. Hair thinning happens. And when these changes to your skin happen and collagen production goes down, we actually have a peptide, GHKCU, which can bring this back. We naturally produce GHKCU, we lose it as we age. There's been studies showing GHKCU can help improve skin lines and wrinkles. It's topically, we know this. Anyone out there's tried GHKCU will tell you, hey, my skin has started looking better. Hey, my hair is looking better. I have before and afters on Instagram before I went through my transformation and really started using all the things I talk about. And my God, I look back and just see my receding hairline. I just am like, oh my God, how was my hair? How did I have not that? How did I lose all my hair? And honestly, one of the things that really helped me was GHKCU help bring some of that hair level back. I can't say GHKCU fixes everyone's skin, right? This isn't the magic elixir. It's not going to beat Botox. You're not that says, I don't want Botox. Give me the GHKCU. It's great. It's not a replacement, right? The things that we're bringing with peptides, I want everyone to understand these are adjuncts to most of the things we're doing. These are not replacements for everything, right? We're trying, it's just like the GLP-1s. We're not replacing a healthy diet by saying, here's your GLP-1, good luck. See you in a year. Let me know when that weight loss happens and hope it doesn't come back. What we're trying to do is do the things to add to the care that we're doing already, right? Skincare should already include some kind of retinoic acid, usually. We should be using sunscreen. If you're not using sunscreen, anyone out there, this is your call to action. Put sunscreen on. You should be using sunscreen. That's a major, major way that you're going to damage your skin. Oxidative damage. We talk about this oxidation stuff all the time. Everyone's on antioxidants. Give me glutathione. I want to have, reduction of my oxidative stress. I want to have, more antioxidants. Well, the sun is very damaging. So obviously, I'm going to tell you again and again, the huge one, wear sunscreen. Vitamin C also reduces oxidation. So the top three any dermatologist recommend to you for skincare, you can go to CVS, you can go to Walgreens. It doesn't have to be your fancy Korean skincare that I know the rage is right now. Everyone's on Korean skincare. We all want the good Korean skincare. And it doesn't have to be that. You do the basics and you can add a GHKCU in there. You can add something because GHKCU not only improves your collagen production, but also helps reduce some of the damage you get from the sun. So there's actually sun damage reduction that happens from topical GHKCU. And again, in the injection, it's still going to improve that. The topical is probably a little better for that if you're using it for skin. But anytime you have some kind of skin damage, just know the GHKCU helps that. It does also help repair DNA. It works on a bunch of different genes and helps repair these genes. So you're having gene repair going on while also improving skin repair. And then there's the hair. I mean, there's so many reasons why I love GHKCU. And again, people come out there. For anyone listening here, when you talk about this to others and try to explain this, there are going to be haters that say there's no human data on this, whatever. They say this all. This is the most common thing I hear when I speak about this. And I want to say it is naturally made. And you're right. The lack of human data, for sure, is something that I'm concerned with. I'd like to see some data on how well it works. I don't think that it's a dangerous product. That's not the fear. The fear is, how well does this actually work? There's just not good human data because, again, it's naturally occurring. And for anyone that's taken it can tell you, oh my God, I started taking this and my hair started growing. I mean, I have thousands of patients now I've treated with GHKCU. And the results, again, this isn't placebo. I'm having patients come back and show me, hey, my hair started growing here, started growing here. One of the things that GHKCU does is block weekly something called DHT, which is dihydrotestosterone. DHT levels go up in women and in men, especially for testosterone. And this is what actually leads to male pattern baldness. So if you can weekly lower these DHT levels at the hair level, now inflammation at the hair level goes down, allowing for the hair follicles to become bigger, thicker, and start making more. If they're totally dormant, they're gone. I mean, there's not much we can do at that point. But again, it does help rescue hair follicles that have been damaged. So, I mean, GHKCU is one of my favorite peptides out there. I can't say enough about it. And I get so frustrated when people try to say it doesn't do anything or not even doesn't do anything. Maybe they're just saying it does no good data. And again, I would love, maybe, honey, I can convince to start doing some kind of IRB and actually study some of this stuff. I'd love that this actually happened because coming to people with data is the best thing we can do. And unfortunately, even though we see a lot of good information from patients that we treat, it's just there isn't that research paper I can pull and say, hey, in humans, here's how it works. We have 40% more hair growth. And again, I see it all the time. And I'm sure those of you out there that have tried GHKCU will say, I use GHKCU. My hair is so much better than it was. Or, hey, my skin has improved. It glows. I, I just can't say enough about GHK. You got me excited. I'm really sorry.
We're excited and we're so grateful to have you on these series repeatedly because your anecdotal experience with these patients is so valuable when there's not large clinical studies out there, traditional trials that occur in the USA,
Mhm.
FDA, but it's so important with the direct interaction with the patient, seeing them improve. And that's why doctors keep going back to these peptides. They believe in them and they see the
Mhm.
outcomes in their patients.
And it's
Of
so
course.
valuable because this is the information like we can't find online and it's
Yeah.
all in your head and we gotta
Yeah.
so thank you for sharing with us.
You just go to
Um
Reddit. Just search in Reddit. I'm sure there's plenty of
it's
Reddit stuff you'll
okay.
find. There's a lot out there.
Okay. Just sticking on GHKCU, but switching gears a little bit, can you address, this is a comment, can you address histamine intolerance if GHKCU typically triggers it? And if so,
KPV
or
help.
Guess
yeah,
what?
with
We have
KP.
KPV. KPV helps lower histamine. So anyone out there that's wondering what I do with GHKCU, well, guess what? Now you have KPV added in. KPV is that extra layer of anti-inflammatory. There's some good, again, lack of studies in KPV. It's not human, just so we know, just so we understand. BP757, GHKCU, and KPV have a lack of human data, just so we're all clear. Now, it doesn't mean they don't work, just much data. TB500 also technically has a lack of data. Thymosin beta 4 has a lot of human data. It actually was developed as a drug. They made a smaller version of it, 7 amino acids. They call it TB500. It really just works on the healing part. There's no immune side to it, which is thymosin beta 4 has some immune. Anyway, so we have one of these four that has some human data. Now, the KPV has really good data showing, at least in animals and in petri dishes, how it can help lower your histamine tolerance. And also, there's some good information showing it can actually help with endothelial lining, which is the lining of the blood vessels. So, one of the things I use KPV for is prevention of heart disease. What happens as we get older is heart disease obviously gets worse. You make more plaque in the arteries. If you have inflammation plus high cholesterol, you have plaquing. And KPV is one of those things we can use to help counteract that. So I'm actually using KPV in practice for preventing heart disease in patients. Again, the data, again, does not exist, but I know the research and I know how this actual works. It's a melanocortin receptor peptide. That's what it works on. And what it's going to do is help reduce the inflammation going on. It reduces inflammation and it also works in histamine responses, works downstream. So I wouldn't think of KPV as preventing seasonal allergies, but I would think of KPV as, hey, I'm getting an injection site, flare. It's causing a little histamine, it's redness, it's a little itchy. Yeah, it's going to treat that. If you have a histamine response whole body, no, KPV is not going to fix this. It's not Benadryl. It's not ranitidine. It's not a traditional histamine blocker that you would think of to take. What it is going to work on the downstream effects of histamine. So I do encourage people that have GHKCU issues, take the KLOW. That's one way to kind of counteract that. And your product, you two just told me your dosing that you had is spot on. Whoever came with that formula did a really good job. We both thank Kevin for that one. I don't know. But I know that what what's being done out there for most people on KPV is they're doing lower dosing of it, and that lowering dosing doesn't work as well. So the 600 micrograms of KPV that's in each one of these injections that you're doing, it does a really good job at stopping that site reaction. And my gosh, I have patients with histamine responses. I give them a KPV and they get better. In fact, I just had a patient last week that was in my clinic discussing histamine. And he has food intolerances actually. And he was so surprised. He started his KPV, again, injection. This isn't oral, which is the other way I use it, and he said he couldn't believe how much better he felt. He also has some sinusitis, like some seasonal stuff, allergies going on. He said it's reduced his reliance on any kind of regular Benadryl. Like, I'm just noticing I can breathe better on this. So this is injectable KPV, and I'm seeing their inflammation going down, which is one reason why he's feeling better, and two, the histamine response coming down. So there's your answer. If you have GHKCU does cause the histamine response, there's also a really good trick. Um, Alka-Seltzer Gold. Alka-Seltzer Gold is actually many, many years ago, 9 years ago, when I started talking about peptides, this is something people would use. If they're having histamine responses from peptides, it takes an alkaline seltzer gold, drop it in a little water and drink it, and actually supposedly helped. I can't say many patients of mine did this at the time. I wasn't having as many reactions. I should have as many patients back when I started peptides. It was just not, it was newer. But I do know that is one of the things we talk about is using alkaline seltzer gold, a little bicarb will help reduce sometimes the histamine response. So that's an option for GHK.
And with KPV, added on top of this, it's glow stack plus the KPV. Can you talk about why it's important to address inflammation before treating the body for like these repair mechanisms and kind of building?
And in your
Yeah,
same answer to this question, can we also just talk about inflammation in general? We know it's part of the repair response,
of
but
course.
we know that it can be good or bad. So maybe
Yeah.
tie that in.
Thank you. Thanks, Sam. So let me give you a kind of a little story to go along with this. You can maybe understand. We do a therapy in our practice called perineural injection therapy. So perineural injection therapy uses basically just sugar water, B5W. We inject areas that pain. So if a patient comes into practice, typically the first thing uses peptides. If they're not getting better, we use this perineural injection therapy. And what I tell people is what we're doing is we're injecting the sugar water sub-Q, the same size needles everyone's using for peptides. We'll do it along the nerve route that's typically having pain. So when I'll palpate the area, oh, is this where pain is? We kind of follow the nerve up. When I do this therapy, I start injecting this, the people feel better. We finish this injection therapy and the pain is usually gone. It works super well. If anyone has any kind of pain, musculoskeletal, I highly recommend looking at perineural injection therapy if peptides have not been enough. Now, when I tell people this is going on, there's inflammation. Anytime there's pain, there's inflammation. Okay, that's just it. I think we all understand you're inflamed, right? You get an injury, you look, you see it's a little swollen, and there's inflammation. When I use this therapy on patients, when I start to reduce inflammation, what's happening with this perineural injection therapy is it's reducing inflammation at the cell level, at the nerve level, actually. It takes a molecule of sugar and puts it in, takes in a molecule of sodium. Just like everyone, the more sodium we have, the more salt we have, the more bloated we get. So these nerves the same way. The sodium stuck in there, it can't get rid of it. It can take in glucose. It can use that as fuel, but it can't use the sodium. So there's a receptor called TrkV1, pulls up the sodium, puts in the glucose. What happens is we'll bring inflammation down to nerve level. So the first thing that has to happen is I have to remove inflammation. Once inflammation happens, these cytokines, basically these nerves send out these inflammatory cytokines, interleukin 6, TNF alpha, interleukin 1, and these cytokines are like saying, hey, come fix me. We're broken. We're fixed. We don't know what to do. If you do not remove that call to action of your body saying, come fix me, you can't repair because the inflammation stays and it keeps saying, come fix me, come fix me. The tissue's not able to heal itself until these cytokines are removed. So removing the inflammation first allows everything to get better. So I always tell people, hey, this therapy might take 4 treatments, maybe 5, because the first treatment is we're starting to get rid of that inflammation. And now your body's starting the healing process. So when I treat someone, I'm saying it's 4 weeks before you're actually fully healed now, because this is the first step of removing the inflammation. Now you get to heal. And this is why it's so important to use things like KPV to reduce inflammation. Now, BPC also works at reducing inflammation as well. It has other pathways it works on, and it's going to reduce that inflammation. One of the things that people ask about these peptides is do I have to inject near the site of the injury? That is what everyone asks. And my simple answer is if you're doing an IM, sort of intramuscular longer needle injection, it's likely it'll sit in that area a little bit longer. Sub-Q goes into the lymphatic system. Once it goes in the lymphatic system, it goes everywhere. So injecting near the site of an injury with a small little insulin needle is unlikely to do much good. All the data points to it may or may not work. If people want to do it near the site of the injury, where their injury is, it's not going to hurt them. In practice, I don't see it helping much. I've only had one single patient improve from injecting near the site of the injury, they did BPC, and they use an iron needle. And it's exactly like I said, iron needles is going to hold in that area a little bit longer, goes into the muscle and sits there. So that's the only time I truly think that I see some improvement if someone's going to do it. Otherwise, these injections, in your belly, in your butt, in your arm, wherever you want to do it, is going to hit systemic. And again, what we're trying to do is reduce the inflammation and then add that healing point. So that KPB really does make a difference at reducing inflammation systemically, allowing for faster, better healing. That's ultimately we want to do. We want to reduce inflammation. And this is across lifespan. Health span is all about having more inflammation as we get older and reducing overall levels of inflammation will allow the whole body to get better. So one of the first things I do when I talk to patients about healing, I discuss diet, nutrition, right? This is one area I'm big and proponent on. I talk about GLP-1, talk about anything, right? If we aren't fixing the gut, we aren't healing everything, you're going to have inflammation. I'm sorry, but this is the big thing I tell people. gluten, dairy, eggs, your top three allergens. These are the three things that cause inflammation in our diet most commonly. It's what we eat the most of. And when I start removing these things, people's inflammation goes down, allows for better healing too. So I'm always recommending, hey, let's look at the diet as well as this. It's not just about doing these injections. We want to make sure when we're discussing this stuff, we're able to talk about the whole picture. Because,
Mhm.
people don't want to take, KLOW for an injury for the next 10 years. The injury never really gets better. It's a little better, but it's not improving. So if we can remove overall inflammation, the first step I always do is diet. And I always just say, hey, take 30 days, skip one, take gluten out, take dairy out for 30 days. See where you're at. On the 30th day, 31st day, you eat some dairy, you have pizza, cheese, whatever, and you have loose stool, your stomach hurts, you're bloated, you have an allergy. You should be eating that. I think most of us get used to feeling how we do. And trying to reduce inflammation from any outside source is number one. We have exposures to all sorts of chemicals. Unfortunately, you ladies are young and are going to have way more exposures than I did when I was young. And it's just going to get worse for the next generation. So, what we're trying to do is reduce inflammation now. And out there listening, doing some kind of elimination diet to help your pain is one of the simplest things you can do. And we don't need to be giving you peptides for that. This is just simple, simple thing. And then you layer peptides on there. Everything works better when inflammation goes down. Everything, which is
Mhm.
why we're adding peptides like KPV to reduce the inflammation so that systemically you actually can heal a lot better than you would naturally.
That's great. I mean, reminds me of a quote an old professor in like biology or chemistry said, we live in a world where we're exposed to so many toxins. Like
Mhm.
everything's going to give you cancer, but you can take little steps each day to try to eliminate toxins in a small area. You don't need to completely revamp your life, but little things for your health every day, small changes. And segue, I'm like so excited to talk about gut health, but if we can like step back a little bit, talk about BPC 157 and TB 500. What do they do? How are they different from each other?
Yeah, the quote unquote Wolverine stack, right? That we talk about here. So BP757 does a lot of angiogenesis. That's big on making more blood vessels. When I talk about making more blood vessels, the way the BPC works is more of angiomodification rather than angiogenesis. It's going to work at the site of injury. So if the injured area is in your maybe right elbow, right on the side, it's going to go to that area and say, hey, we need more blood vessels specifically here, not everywhere. Now, that really does kind of, cause some issues because if you have cancer, this thing we talk about why you can't take these things with cancer is angiogenesis. It's the biggest reason why contraindication is cancer. But BPC, I am less concerned. Again, this isn't, this is my own words, not what LMD wants. But my concern is not cancer with patients, not growing cancer, because of the way BPC works, it's unlikely to have angiogenesis go towards the cancer because it's going towards injury and the cytokines that come from injured tissue. Now, thymosin beta 4 or TB500 does have some information on cancer. And cancer, actually, we see it go up in some cancers. TB500, I'm less, more cautious with the cancer because, again, same thing, angiogenesis, but it does angiogenesis more everywhere. So I think of BPC as angiomodification going towards the site of injury, and TB500 is kind of more blood vessels everywhere. The other difference is TB500 also has this actin piece to it. So when your cells move, they want like a little track they're moving on, and TB500 helps improve that track to move these cells, like macrophages, to these areas to help improve how well that healing goes. So think of BP757 as really just improving like the blood flow to the area. It's also going to reduce inflammation. There's inflammation reductions. And TB500 is more of blood flow plus moving the cells that need to be there to help heal the tissue to that area. So that's kind of where the difference is. One is more anti-inflammatory and just angiomodification, and the other one is more, hey, we're moving the cells to this area to get all the debris and the crap out of there. Because when you injure tissue, there's just cellular debris that needs to be cleaned up. And that's something has to come there and take it out, scoop it out, and move it out of the way to help reduce inflammation and to help improve overall healing capabilities.
You know, if you want.
Yeah, I mean that reminds me of like this analogy when I was first learning about this is that like TB 500 basically serves as the guy who's like rallying the construction crew up like, "Oh, we got to go fix that repair." And then BPC is more like the guys that are on site actually, priming
Exactly.
the
It's exactly what it
environment.
is. It's exactly what it is. They overlap with the angiogenesis, the more blood flow. Like that's where they're kind of like together. But it's TP500 is like more systemic, right? It's more about the whole body, where BP757 is really like going to that tissue that needs to be healed. Like this tissue is damaged, we're gonna go right here. And TP500 is more of a systemic kind of lowering or improvement of like blood flow. That's kind of how I see it. Yeah.
How can KLOW help address gut health and inflammation?
Oh, that's a big one. So in our gut, when you take KPV orally, there's a receptor, a tripeptide receptor. So KPV is three amino acids. It's one of the few amino acids they actually get to the gut and be useful. Still going to hit the gut when you take it orally. So don't think oral KPV is going to work the same way that you have a injectable KPV. But when you do oral KPV, huge gut improvements because it's again reducing the histamine response. And a lot of people, like I just said, is it's the foods we're eating, right? It's the wrong foods. We're not eating the right stuff. We're having gut inflammation because the foods we're taking in are things we're allergic to. There is gut testing. I do offer to patients if they want it. I always say just eliminate. Don't eat. Just cut out the top three allergens and see what happens. If you're eating the same thing every day, I'm eating chicken every single day. Very often, your body starts to get an allergy to the same thing you eat every day because it's like getting the same exposure all the time. So you're going to be cut that food out for a little while. It's also very common. So KPV brings that histamine response down. And when you're eating foods that you have an allergy to, you have a histamine response. Keep hitting histamine again and again. Anyone that has mast cell activation syndrome will tell you, the MACAs, they'll say, hey, I eat this food and here's like I have a histamine response because the foods can cause histamine to be released. KPV lowers that histamine threshold and allows your body to have less histamine being released. And again, anti-inflammatory. So it's a great anti-inflammatory, gut included, and then also is lowering the histamine response. So you have less of the histamine in the gut, and then reducing the amount of stomach discomfort, bloating that goes on for people that are having any kind of allergies to food they're eating. That's typically where it's at. Most of our gut issues are because we're eating the wrong foods. There are things like SIBO and there's ulcerative colitis, there are autoimmune, there are other things that go on. And even in those conditions, such as irritable bowel syndrome or ulcerative colitis, Crohn's disease, KBV works very well. In fact, all of my autoimmune patients that have bowel disease, they're on KBV. KPV does such a good job of just quieting inflammation of the gut, much better than BPC. So we think of BPC as a good anti-inflammatory. It's not bad. It's pretty good. I think of GLP-1s as the top-notch anti-inflammatory I have. And then secondary behind that, I see KPV. It's always my second one I see for generalized inflammation. KPV goes second. So anything that's going on inflammatory, I don't care if it's the gut, I don't care if it's your skin. There's also KPV for skin is amazing. If you have um, I don't know, acne, for example, psoriasis, eczema. KPV is wonderful for this. So any skin condition people having, I'm using KPV. Anything inflammatory, after I took to GLP-1, the secondary thing is always KPV. It has just been phenomenal for use. I often will not start with KPV as the anti-inflammatory because the GLP-1s just work so well unless someone is unfortunately, we do have those people, I'm sure all of you have talked to, who are deathly afraid of GLP-1s. They're going to cause, me to go blind and I'm going to get rectal cancer and I'm going to die, right? We've heard those stories. And, people get scared. So if they're not willing to do a GLP-1, KPV is my next option. But if I can, it's always GLP-1, KPV. And I use my GLP-1s for my autoimmune patients too, even my gut autoimmune patients. It
Yeah.
doesn't always work, but it is a great, great, great option. So I'm using those kind of that strategy. And anytime there's inflammation, I just have to reiterate this: KPV is where you're at. BPC, again, good for inflammation for tissue damage, not systemic overall inflammation. KPV is much better for that.
God, thank you for kind of taking us along like a patient journey, right? You might address with a GLP-1 first. And I
Mhm.
know all of these peptides are amazing. How do you just choose one? And a lot of people are on other products like just GHKCU. We also offer BPC with TB 500.
Mhm.
How would someone make a decision, right? Should I use KLOW or should I just do GHKCU or should I do BP, the Wolverine stack?
Yeah, that's a good question. I mean, that's my everyday question for patients. Um, if I could put anyone with an injury on KLOW, I would. No questions asked. The only reason I would use BP 757, TB 500 by itself, cost. Ultimately, cost. It's not because I think the BP 757, KP, or TB 500 is a better product by itself, good standalone. It is purely what the cost is. I think the top product is BP 757, TB 500, GHKCU, and KPV. In fact, I'm taking that right now. I unfortunately was at a Barry's boot camp workout on Saturday, and I don't
Those
know
are
what I
tough.
did. They are tough. Look, I hit 20 on the treadmill. Let me tell you, 20 miles an hour. I can hit it. Still young at heart.
You could do that.
And I did something. I don't know what it is. I got off the floor. I stood up. Anyone doesn't know Barry's boot camp? It's basically half on the floor and half it's on treadmill running. And I'm on the floor. I get up. They're yelling at you. It's a red room. Everyone's yelling at you. You're sweating profusely. And my knee hurts and I had pain in it. And I go to run. So I have like the last, maybe a mile of run left. And I'm like, okay, well, I'm going to do this. I'm in pain, but this is how I'm not going to stop. I mean, that's crazy. So I finish my class. I get home and my knee's swollen. I mean, completely swollen. I don't have any KLOW at home. So I get to clinic on Monday. This is Saturday. I swollen to come down some and I injected stem cells. I injected exosomes and did an exosome IV. Listen, I'm going to Formula One tomorrow in Miami, and I'm like, I want this knee to work. I want to go run. I want to be on the beach. Like this has got to work by this weekend. I can't take time off. I refuse. And in that scenario, I'm like, KLOW. It's always KLOW. So I immediately have my office. Can you get me KLOW today? I need it right now. So I get there Monday, and they had a bottle for me ready to go. And I'm always doing KLOW. If there's a tissue injury, right, we want inflammation to come down. So KPV, BP757. We want to move the cells to that area to clean all the debris up. TB500. And we want to improve that collagen production. And also, GHKCU also has a giant anti-inflammatory part to it. So I've had patients that put on GHKCU. God, this is a while ago. A woman that had osteoarthritis, and it wasn't her primary complaint. Her primary complaint was my hair. I'm 60 something years old. My hair is not as good. I want this. We put her on GHKCU. She goes, "Oh my God, my arthritis is better." So of course, I'm like, well, yeah, it's an anti-inflammatory, but I didn't know you had arthritis. She goes, "Oh, I do. It's really bad." And we put her on GHKC and she felt so much better. And this is great because you can just layer things, right? The way peptides work, what we love about it is you can stack them, right? This isn't like a traditional medicine. We're not putting you on the next one blood pressure medicine and the next one and the next one, just hoping to God these things work, or just hoping you don't have a problem when I add more meds. There's no polypharmacy going on with peptides. It is incredibly safe to be layering things on each other. For the most part, most peptides can be added to any routine. For almost everyone, almost every condition, peptides can be added in without any serious conditions. Now, there are a few blood disorders where BP757, TB500 are not exactly useful. In fact, if you're going to call up and get this stuff, they will say, hey, if you have, factor V Leiden or something like that, they may say no. And there's good reasons. There's some anticoagulant effects to these. But in general, there's not really a patient, I would say, that they're having issues or having injuries or even want better repair recovery shouldn't be on KLOW. I personally run BP757 nonstop. I never come off. There's no 8 weeks, 12 weeks, 14 weeks, 20 weeks, a year. It is always on. For me, it is water. I never stop BP757 personally, and I have many patients I do that with. When it comes to GHKCU, 8 weeks on, 4 weeks off. TB500, 8 weeks on, 4 weeks off. KPV is another one I will run nonstop. I also run that long term in patients that are seeing benefits. There's no real contraindications I'm worried about. So I'm running KLOW my 8 weeks on. I'm stopping, taking 4 weeks off, going back. I just run KLOW nonstop. I don't go, I don't take BP757 and TB500 unless patients are saying to me, it's the cost, then that's when it really matters because it's the cost that really is concerning to people. And again, it's not because the stack doesn't work the best, right? The most anti-inflammatory stack with the most healing capabilities is going to be the KLOW stack, which is why it works which is why everyone wants it. I mean, everyone wants to have low inflammation again and heal all the time. It's just, can I afford to be on this? And that's really it. And you have to talk to yourself is, well, can I afford to not feel better? And I think that's the thing. We talk about health span so much. I understand peptides are expensive. I do, but also so is aging and feeling like crap and being in pain and doing these things and not feeling great. I, for me personally, I've decided I made a big change in my life. I gave up alcohol. I've changed the way I live my life. I work out twice a day. To me, everything with my health comes first. I will spend any amount of money on my health at this point, and I'm only in my 40s, but I've said, look, I see patients, I treat them, I see them in their 40s, I see them in their 50s, I've seen them in their 60s. I watch what happens. And the sooner you start doing these things, the better your long-term outcomes are going to be. If you keep your inflammation lower, you're going to be better off. Now, you need some inflammation, right? You talked about going to Barry's boot camp. I need that you go to work out, you build inflammation, you're tearing muscle fibers, do this. There is some level of inflammation we do want. Okay. Inflammation is not always unhealthy. I don't want anyone to think that. This is why using cold plunge immediately after a hard workout to stop inflammation is not good. But KPP is not working the same way. It's going to stop recruitment of, muscle fibers, or started stopping the recruitment of cells to allow your muscles to not heal as fast. Look, it's just generalized reduction of your inflammation. And again, if you're using KPV, the glow stack or KLOW stack, sorry, you're going to be using 8 weeks on, 4 weeks off anyways. So some information will come back unless you just add in BPC by itself, which I don't think we have LEMD yet, but I'm hoping eventually there's a standalone BPC so people can be on that long term and just be like, I'm always running this. I always feel good. Um, Anyway, I lost
Yes.
sight of your question, but you let me off on tangent. You just keep
We're
talking. So
we're like so excited. I'm not even ready to close this
Me
out,
either.
but out of respect for people's time, I'm gonna address some questions in the chat
Mhm,
just about the strength. This
of
will
course.
be right. If you got prescribed this, it would be very clearly stated on the prescription. But the BPC, TB500, and KPV are all 3 milligrams per milliliter. And per dose, you're getting 600 micrograms of each of those ingredients. GHKCU is 10 milligrams per milliliter. And so with each dose, you would be getting 2 milligrams. And I know there's a lot of questions also about formulating these things together. We had an analytical chemistry PhD at the pharmacy watching this. They call it like a buffering system of the different pHs of the peptides. This has been formulated to be stable together, and it has to go through testing. So don't worry about that. And yeah, we
I
do
think
have
I
a
actually addressed that when I was in Florida, speaking to whatever Ellie group I was talking to down there. But this is the question I got asked on there. Hey, how stable? It's because this is the next question people ask. When you're online, people are going to ask you, I thought you couldn't put GHKCU in this. Bob, of course, I get asked that all the time. Here's the clinical information. We lose about 15 to 20% degradation when you mix all this together. Just so everyone knows, it's about 5 to 6% degradation if you have them all separately. Now, the thing is, it's a lot more expensive to make separately than it is to make together. The reason we mix it together is I would tell you right now, going from bottle to bottle, and I've been doing this for a while. I have a lot of patients on KLOW right now. No one comes to me and says, I just opened a new bottle. I feel so much better than the bottle end. So clinically, that difference, 15% difference degradation, doesn't seem to make a difference in patients. In general, I just want people to understand that degradation from peptides does happen, right? The longer you leave in the fridge, the longer you leave it out, they're going to degrade. My best example of this is I had Milano 10-2 sitting in my mom's garage in the villages in Florida, summertime. She let the bottle out and said, Hey, I have this bottle. It's been sitting out for 2 months. Do you still want it? I'm like, yeah, it's a peptide. I'm not wasting this stuff. Are you crazy? It's gold. So I still use the Milano 10-2 that she had. Did I still get tan? Yeah. One of the adverse effects of Milano 10-2 is you get a little nauseous. You feel a little sick with it. You get tan. You get horny. Everything happened. I was like, this still all happened. It worked just as well as it normally would for me. So, and I'm sure the degradation had happened quite a bit. But again, here is like the analytical, and then here's the clinical, right? You can't always just say, yeah, analytically, yep, this is, we know for sure this is what happens. But clinically in patients, I don't see that change. No one starts taking KLOW and says, oh my gosh, that new bottle, oof, I feel that fresh feeling of better anti-inflammatory and healing capabilities. I don't see that in practice. When someone gets on a KLOW or GLOW with me, they still see the benefits from one bottle to the next. No one sits there and no one's ever asked me, hey, what's the degradation? Unless they go online and they see what people talking about. There's plenty of people talking about this. There's a couple really big influencers I know who discuss this, and they get really caught up on like the science behind it. And I'm not saying the science doesn't matter. And of course, I'm not saying degradation doesn't matter. We'd like it to be 100% all the time. But clinically speaking, I don't see that change from people going from bottle to bottle, month to month. And if I did, then I think I'd be more concerned and say, oh my gosh, 20%, they get on the new bottle, like, oh my God, this works so much better. I can't wait to get on the new bottle. It just isn't what happens. So yes, some degradation does happen, a little faster degradation you'd see with each separately, but not enough to make a clinical difference in people taking this.
Thank you for that. We're just scanning the chat. I mean, there's so many questions, y'all, and we want to be conscious of everyone's time.
I see someone that said something about their Instagram being banned from Instagram because they're sharing information. Yeah, guess what? That happens to me too. I've had like 5 videos removed because I talked about how BPC 157 works. That was like a 3-year-old video. So right now, just so everyone's aware, anytime you talk about this stuff, be very careful how you discuss these things. This is something I've learned over the last basically 2 months. Since January, their AI for Meta has become much stronger and they're using it really hard. I mean, peptides are everywhere, right? Everyone that's here, peptides. We talked about everyone and their mother and their brother. I have a group of guys I go on a boat with every summer, and one of the random girls is like posting on Instagram, "Come get Tegrity peptides for me." And I'm like, "Oh Jesus Christ, this is where we're at." Okay, and I had to talk to her and just be like, "Can you at least get like a quality company? This is like a South Park joke of a peptide name. Like maybe at least make it sound a little more legit if you're selling this stuff." And I want to say that, people talk about this all the time, and anyone can talk about this stuff. The problem is when we say treats, or it can get better, those are the words to watch out for. I learned this the hard way. Again, I've had videos removed. I can't do collabs with people right now, which sucks. They downgraded my videos for a little while, and it was really not fun. And unfortunately, every video I have from the past, I have 1,000 videos. I'm not gonna go delete all the videos I have. So I'm more careful now with how I present things. But when you're saying treats or fixes or heals, like that's like major no-no. You can talk about papers, you can talk about, information. This peptide has been found in research to do this. That's how we discuss things now. That's the safest way to do it. Someone out there wants to talk about stuff. Hey, this is my personal journey, and in the research, this is what it shows. Right. So you want to keep it as away from as much as you can. This does this. If we're saying it does this, again, medical provider here, I can't say that stuff. So if I can't say it for sure, no one else can say it. So I just want to let people know, like when you do talk about this stuff, just make sure it's the wording. I don't know if Ellie has a course on this. It probably should be somewhere, how to discuss
Mhm.
stuff without being shut down, because it is very common to see people's videos get taken down and then just shutting the whole account down if it happens enough.
Super
Thank
tricky.
you for addressing that, because a lot of our people in our community, they're active on social media and you want to share, right? This has changed your life. You want to change someone's life, but you do need to be careful. We use words like it may support. And I love the frame of like, don't imagine BPC like sewing up your tissue and repairing it. It's creating the environment for that to occur. And so to
Yeah.
think of it that way, that the peptides are just creating a favorable environment for these positive changes to occur. And oh,
I just have a quick, just anything else. I have a quick last question, because we saw it much earlier on in the comments about combining MOTS-C with this stack. I know you talked about like cellular energy, mitochondria being very important in the repair process.
For
So
sure. Oh, I mean, for sure. I mean, anytime I'm doing healing repair, the question is how much patients will pay, how much someone will spend, right? That's the ultimate thing. And I think that's where the peptide medicine becomes hard, right? Because this isn't cheap. Let's be real, guys. This is out of pocket. There is little data. Your friends and family think you're stupid for injecting stuff. This isn't like normal medicine. If I can convince someone to do MOTS-C with this or NAD as well, because NAD is also improving that cellular energy, yeah, for sure, I'm doing this. Methylene blue, like these things all get stacked together. In a surgery patient post surgery, I'm using NAD. It's happening post surgery. My post surgery stack is GHKCU, TB500, BPC 157, and KPV and NAD. So, and I use thimerosal 1 as well. So LEMD has all those things. My post surgery patients come back and their doctors say, "What did you do? How did you heal so well?" Oh my God, I don't see people doing this. Yeah, because these doctors, unfortunately, they don't believe, some of them just don't believe in this medicine. They get really angry about it, like very angry, really frustrated. And maybe it's because we have some people talk about this stuff now. And it's like everywhere. One of my patients came in today and she's like, "I get my peptides online for my friend." I'm like, "Oh, that you do. Cool. So what do you need me for? Am I necessary right now? Like, go find them." I think that's the problem with practitioners like me. Are like, I'm seeing like, well, should you be talking to me? Like, I'm actually doing this every day, all day. But the problem is, and the reason why LEMD is so adamant about having these is we want all of you educated. So you know how to talk about this stuff, right? So you can actually sound smart and like you understand what's going on. Because the biggest thing is these people that come to talk to all of us, they want to talk to the doctor and sound smart and not the doctor say, "Well, you're an idiot for injecting stuff that's not safe and not tested. And where's the pharmacy? And you should be making that." Like all the things that people get said, right? That's so frustrating for all of us to hear, because a lot of us have tried this stuff and says, "No, it works." Like I'm telling you, I take it and it works. Look at my lab data. My labs show this. My labs have gotten better. You can look at this stuff and say, "Oh my God." And the doctor's just, "Oh, cool. That's great." So I think that uh my issue with the peptides and doing this stuff is just how much people spend, right? That's my ultimate thing, is like how much we spend. Yes, I think MOTS is great. I think NAD is great. If you can do all those things for cellular repair and improve that, for sure, add more. But it comes to like a specific injury and you're like, I'm limited budget, right? And I'm like, where does my money go? Yeah, the close stack is like your best, fastest, really most powerful healing tool that you have. And then if you can sprinkle in MOTS or NAD, yeah, please, it's going to help the mitochondria. It's only going to be more useful.
and TA1.
And yes, I love TA1. Yes, put TA1 in there too. Look, they're all the peptides you guys offer. I use all of them in practice and more. So, I mean, I'm all about using them. It's all the time and place. It's just the reason we do this is to help everyone understand time and place. And as I said, the close stack, there really is the time and place is pretty much whenever you can. This is what I cycle off and on. I don't do Glow by itself. I don't do TB 500 by itself. I do BPC by itself only because I can't run Glow all the time. Otherwise, I'm on Glow and then I'm off and then I'm on Glow and then I'm off. And this is how my life will be as long as I can imagine, going off on these peptides until there's something better comes along.
That's great. And just last note, so with the cycling off, the typical protocol is going to be 8 weeks on this and then 2 weeks
4 weeks off.
off. Some people may take 4 to 6 weeks off. It depends
Mhm.
on conversations with their provider and what's appropriate
Mhm.
for their health. We don't like to just generalize. Is there any last closing remarks, Dr. Pencek, that you want to talk about before we close out here?
I do think if you guys don't offer a course on how to talk about this stuff, I hope you do. This should be
We
something we do.
do.
Okay, you do. Good. Well, you should probably do another one because it seems like a lot of people are probably confused on how this works. Um, I would say that's a big one. And also, I am really excited that Honey has moved from like, hey, we're just GLP-1s and doing this to really, hey, I'm really wanting to be a health span company and help improve people's lives and the life, not even just lifespan, but health span. How long am I living this life and feeling good? Because, like I said, 26 ladies, I'm so sorry. This is it, right? All we're doing is this. And we want to bring you back to function and keep you here as long as we can. That's every patient I say. My mom was about to be 80. She just came to visit me, gave her some exosomes. She was here this weekend from Florida. And she looks like she's in her, in her 50s and 60s. She has the energy of that and like just feels so on top of 80 years old. And I see my mom, look at her, I'm like, you don't look your age. And again, that's because she's been on peptides now since she's been 72. So like I just want to tell people, and before that, I have pictures before and after, and she looks from 65 to 72, she looked like age backwards. So you can start this stuff at any age. No one has to think, oh my God, I'm 80 years old. I can't do peptides. It's not going to help me. It's going to help at any age, right? Improving health span at any point in time is going to be useful. The sooner you start, the better long-term outcomes will be. But of course, at any point you can improve how you're feeling.
That's great. And how can the community find you if they want to watch more of your
Oh,
content?
yes. It's at Dr. period Jason Pencek on Instagram. I am also technically Dr. Thirst Trap on TikTok, but I haven't used it, and my staff have yelled at me to get rid of Dr. Thirst Trap and to make it something else, but I haven't. I
Don't
am
get
going to
rid of
start.
it.
I'm going to
It's
start
funny.
posting more on TikTok pretty soon. I'm going to start working with the company and start producing more content. So that's right now the biggest place. I'm on Instagram. I post there every day. Anyone has questions, please reach out to me. I answer basically everyone. And I try to respond back to as many comments as I possibly can. But yeah.
I love your Instagram and I'm so excited for your TikToks. Just
Thanks.
but
I
okay,
am funnier in person than I am on Instagram, guys. I'm so sorry. I try to be dry and boring. Here's how this works. This is what we're doing. The end. But maybe TikTok will be a little more funny videos than I do now. So maybe I'll change my
we're
content up a little
excited.
bit.
Okay, well, thank you so much, Dr. Jason, for sharing all these insights. And to all of our guests, thank you for joining us. If you were invited to this call by someone, please be sure to reach out to them and say thank you. And Jason, thank you again. To all of you guys, good night. Thank you.
Happy Thursday,
Happy
everyone.
Thursday.
Thank you so much. Have a good one.
Right. Bye.